Skincare Lovelies. Today we're going to be chatting about melasma. If this is something that is affecting you or affecting someone that you care about, what is melasma? It's a pigmentation disturbance, and it's one of our more serious pigmentation concerns, the photo-aging concern. And the aging part of it means the pathology is just marching on, will progress, will become exacerbated in time. So why do we have it? It's genetic. Someone has passed down the tendency for you to manifest with these tan, brown, grayish patches on your skin, on the face primarily. And the genetics, there are so many that play a part. From the studies we understand, from between 279 to 334. So many different genes speaking to the pigment cells being hyperactive. And that's an important part. It's not an increase in number of pigment cells, it's the pigment cells just being irritable, super sensitive, and firing to different stimuli. And one of those stimuli is sun exposure, so both the UV spectrum as well as the visible light spectrum. So photoprotection is key if you are trying to prevent progression. It is everything. That means sunscreen every day, adequate amount, daily reapplication. If you're outdoors, sunscreen does not make you immune, it protects you. So over and above this, you have your beautiful sun hat, you're shielding up effectively. And then aside from that, there are other stimuli that play a part. So even pollution, they find in countries with high pollution indices, these also make the pigment cells more active. Aside from light, aside from pollution, we're also starting to understand that heat plays a part. So perhaps if you're someone who likes to steam your face to open your pores, this is not something you should be doing if you have melasma. If you're someone that enjoys a sauna or a steam room occasionally, maybe you think of another way of unwinding. Even wax that goes on the face. If you're removing hair, think of alternatives, maybe threading. Or even if you're cooking, you're baking, that gust of steam gets onto the face. Be mindful of avoiding these daily exposures that accumulate and make the pigmentation cycle march on. Aside from this, what you may be taking orally may also play a part. So certain medications, for example, the class of non-steroidal anti-inflammatory drugs, Brufen, plays a huge part in driving photosensitivity, and that's going to drive your melasma as well. Small things you do, like your daily application of your makeup, may even be playing a part, because we find for some people perfume can be a sun or a photosensitizer, and lots of makeup will contain perfume you probably aren't even aware of. So in summary, there are many things that make these pigment cells hyperactive, irritable. And now we're starting to understand, importantly, the aging component. So aside from the pigment cell being hyperactive, which are the other players in the group that are almost feeding this bad behavior? And so we know that the fibroblasts, as they age, they also start to send off more pigment stimulating factors. And so aged fibroblasts contribute to this pathway. The skin has its own neat immune system, but we're finding with melasma, the immune cells become a little bit labile, and they start sending off signals that, for example, the mast cells are sending off signals that make the pigment cells more active. We're starting to see or understand a huge contribution from the vascular reactivity in the skin that's playing a part in the melasma progression. So there are multiple factors that speak to the pigment cells being hyperactive. So when you come to your doctor and you ask, can you just peel this away? Just to understand, there's so much going on beneath the layers of the skin that are contributing to this pigment progression or this pigment march. And so the first part we deal with is, one, understanding where we're coming from. Two, making peace with the fact that this is a chronic, recurrent condition. Three, getting on top of it, preventing progression. And four, helping to correct or lift some of that pigmentation safely, effectively. Not necessarily to clarity, but in a way you can feel a lot more comfortable with the skin. So if these are steps you'd like to help with, let's get chatting. Thanks for joining us today, Skincare Lovelies. If you like the content, please like, subscribe, and follow. If you have any comments to leave below, I would love to look through them. And if you'd like more information, please feel free to contact the Dermatology room. Take care, Skincare Lovelies.